The greatest fear that a woman has after her breast cancer treatment is completed is that this disease is going to come back. And it can return in two ways. One we refer to as a local recurrence. So if she underwent a lumpectomy originally and the disease has returned, then her treatment at this point would now be a mastectomy because we aren't able to radiate the breast a second time. But a more concerning form of recurrence is known as distant recurrence. It actually is better known as metastatic breast cancer, stage 4 disease. There is nothing more devastating than having to inform a woman that her disease has spread on to other organs. It usually will go to the lung, the bone, brain, liver, and there isn't a cure for this. We have to switch gears in how we treated it. The first time was acutely with the mission of curing her. But now we're going to have to treat it as a chronic condition for as long as we can while maintaining her quality of life. Now today that can be for quite a few years, and in some instances it actually can be for more than a decade. And that's the good news of it, because if we look back just 30 years ago, most women had died within a year of being diagnosed with metastatic disease. I consider it a privilege to be in the presence of these women who are having to make some very, very difficult decisions, having been very much in touch with their mortality. They know what they're going to die of, and they have some sense after meeting with the medical oncologist as to what that timeline looks like. One of our survivor volunteers is battling this right now and has been very public about it. And I've really appreciated her candor in letting me know what are her fears, what are her wishes, and how does she want to spend her days. We have a tendency, I think, to want to treat women as if I were she. And I think, well, this is how I think I would go about doing this. And quite frankly, that's wrong. And that's one of the things that these patients have taught me, is that I need to find out how does she measure quality of life? What is it that she wants to accomplish with her remaining time? That is our shared goal, and I need to help her achieve that.